Hello there, and a very, very warm welcome indeed from me to the latest in the University of Dundee's Saturday series, bringing experts to you and giving them a chance to interact with your questions. We're discussing tonight the big question of all, escaping to a post-COVID world. Introduce myself briefly. I'm Brian Taylor. For many years, I was the political editor of the BBC in Scotland. I'm now a political commentator and a Herald columnist. I'm also a Dundonian, a very proud Dundonian, and indeed an honorary graduate of this fine university, and also an Arab. Let me translate that. It means a fanatical, and I mean fanatical, supporter of Dundee United. So I come to you fresh this evening from having ousted the might of Forfar from the Scottish Cup in that game last night, but I'm simply delighted to host this event for you. When you hear the speakers underway, perhaps you can submit questions via the Q&A feature. We'll try and put those. We've got some questions already, really good ones, loads of questions, and any questions maybe that we can't get to tonight, I believe the team will try and answer them, or the university certainly will try and help with answering them over the period ahead. And a recording of this event will also be available in the coming weeks. Now let's get underway. Let's get things moving, and we're going to call the speakers in order to set out their expertise in their areas of particular work, and then I'll put questions to them that have come from you. Maybe I won't put every question to every speaker, but we'll just see how it goes. We'll keep it as relaxed as we possibly can. The first speaker I'm delighted to welcome is Dr. Ellie Othersell. She's a specialist in public health and working particularly within NHS Tayside. Can I invite Ellie to address us, please? Ellie.
Thanks very much, Brian. Hello, I'm Ellie Othersell. I normally work most of the time at the medical school. I am the course director and we train medical students to become doctors. This year, since January 2020, most of the time I have been instead working with the NHS in the public health department to help with the local and the national response to COVID. Locally, I've been involved in running our contact tracing system, as well as many, many other aspects of public health response locally. If you speak to my students, you will know that, or you will hear that we have known for many, many years that pandemics are a serious possibility in society, and I have bored them rigid for years, telling them about the different ways that pandemics develop and the responses we might need. I have to say that in all that time, I never really thought that I would live through a time where we had the kind of lockdowns that we have seen over this time period. And I think that that is probably true of most people who work in public health. We have spent an enormous amount of time and many, many, many personnel hours trying to ensure that we are striking a balance between the response for the health of individuals and for the population. And I'm not sure we've always got that balance right, but we've always been trying really, really hard to bring this pandemic to an end and to look after the health of the population. So in some ways, I am like the bad guy of today's discussion, because I am the person who, along with some colleagues, many colleagues, have been trying to implement things like the lockdown and more recently the vaccination programme and so on, trying to bring the best evidence and the best thinking to that planning and organisation. Thank you.
Thank you very much indeed. I'm sure your experience is incredible to bring to this event tonight, and I'm delighted to thank you for your address. Let's move. We'll put questions to you and the others, but I'm delighted also to welcome Professor James Chalmers, Professor of Molecular and Clinical Medicine. Thanks for joining us. And I gather you and your team have treated literally hundreds of patients who've been hospitalised with COVID-19. So again, very direct experience. James, if you would address us, please.
Thank you very much, Brian, for the introduction. As you mentioned, I've split my time over the last 12 months between working as a chest physician, which is my main profession, looking after patients with COVID on the COVID wards, and also conducting clinical trials into coronavirus and doing research into coronavirus at the university. So it's been a very difficult year, and it's been a very challenging year, but a year in which we've also learned a huge amount about how to deal with problems like respiratory viruses, how to conduct research, how to develop vaccines that we hope will stand us in good stead for the future. As Ellie said, we've been through an incredibly difficult period as a country with the lockdowns and with the impact of those. But I'm trying to be positive and thinking about the post-COVID future. I believe there are things that we've learned, particularly in healthcare, which is my area, that will stand us in good stead for the future. We've seen massive acceleration of things like telemedicine that will hopefully help us to treat patients better in future. So I think that there are positives that we can take out of this pandemic, but particularly in the area of health technology. But I think the other message that we need to say as we're thinking about the post-COVID future is that we still have quite a lot of work to do to get to that post-COVID future. We still have a lot of vaccines to administer and a lot of patients to look after before we get there. And so one of the messages that I'm sure Ellie would also support is that we still need to work together as a country to get to that post-COVID future by looking after each other and by getting vaccinated as quickly as possible. So that's my pitch tonight.
James, thank you very much indeed, and a very, very timely warning, because there is an understandable anxiety among the public, but also an understandable rush among the public to get to the post-COVID future. But your point is well made. We're not there yet. Okay, next speaker is a double act, two lecturers in education, Doctors Duncan and Daniela Mercica, and they've been researching learning and teaching during the lockdown as part of their expertise. Could I invite them to address us now, please?
Hello, and thank you very much for this opportunity. We, as Brian has said, we work at the School of Education. I'm an educational psychologist by practice, and I also am involved in the training of educational psychologists at the University of Dundee.
I'm Duncan Murchie. I also work within the School of Education. I work with training of teachers and trying to understand how teachers function in schools.
And so we are here because when lockdown happened, in the second week of lockdown, we got ourselves organized, and we thought that we needed to gather some information, asking teachers and head teachers in primary schools what it was like for them to be continuing teaching and engaging with children and families during the lockdown. And we together with a sizable group from the School of Education, we had in-depth interviews with volunteer teachers and head teachers, realizing that these participants were also parents themselves and carers as well, and struggling to continue teaching and reaching out to families, engaging with new online technology and new media to reach out to people. Our question was, what is the lived experience of these teachers and head teachers? How are they engaging in education? We have obviously a wealth of information, and three main issues that we could expand about is about issues to do with children's learning and people's well-being in that learning, the relationship between teachers and schools, how care was still administered to a very great extent with immense efforts, and also the numerous changes that teachers underwent in order to continue to carry out their job.
Thank you both very much indeed for setting out the events and the issues there. A reminder that this hideous plague, this dreadful pandemic, is a health question, but it's a health question with a range of parameters. It's about physical health. It's very much about psychiatric and psychological health, but it's also about education. It's also about the community. It's also about society. And in that regard, absolutely delighted to welcome our next speaker tonight, our final speaker before we go to submitting the questions to you, is Dr. Robin Sen, a lecturer in social work, and very much focusing on family support issues. Robin, would you address us, please?
Thanks, Brian. Evening, everyone. So my background is as a child and family social worker. And one of the things I've been doing over the last year has been working on an online magazine where people who receive social work services, social workers, student social workers and academics have submitted a number of pieces, and I've analysed those pieces recently, and some of the issues arising. I think when we started the magazine almost a year ago, there was initially a discourse about whether COVID, awful as it was, might be an equaliser, and I think quite quickly we moved away from that. But particularly in terms of people receiving or providing social work services, there were particular inequalities that were raised. One of which was around ethnicity, and there's been a lot of talk about that more broadly, but also about disability, domestic violence, with issues around gender inequalities, and particular groups that seem to be getting forgotten within the broader discourse. So, for example, asylum-seeking minors and issues around their care and treatment, prison populations, and a whole host of other, if you like, marginalised populations before COVID, who seem to be even more marginalised afterwards. One of the issues that came out in the magazine was a move to digital working and different experiences within those. On the positive, in terms of some practitioners talking about the positive possibilities that this gave rise to, people talking about the possibility of having conversations with people that were, in a sense, even more intimate than they might have been able to arrange face-to-face. Practitioners also talking about the way in which you can see yourself gave rise to reflection on their own communication and some kind of assessment of how people were coming across. On the other side, people raising the issue of the digital divide and the move to digital lives meant that if you don't have access to that, or as good access through speedy internet connection, you were left out. But also some later evidence coming on board that families actually had a far more negative experience of the move to particularly formal meetings where there were weighty decisions, for example, around the care of their children being taken, and they were attending these online. So I think a mixed picture that's there, and maybe a different picture depending on points of view. The other issue that I'll raise at this stage, I think, is just around the questions moving out of COVID, about whether or not there were certain groups of people who may have benefited through the lack of surveillance and intervention. So we were thinking about social work and mainly about services where people perhaps don't want that service there, and there's a part of a surveillance and an oversight function, whether or not certain groups of people actually did better because of that. And so I'm very happy to speak about that in more detail. And again, I think a nuanced picture in that regard, but just some of the issues that have been raised in respect of that.
Robin, that's really excellent. Thank you very much indeed, and thanks to all Robin issues that you're raising there already in some of our questions, issues about equality, issues about the nature of work in the future. But I'm going to start with some health questions. We've got one in already, individual not giving the name, but it's a perfectly legitimate question. I've got a range of questions on these as well. The question is basically, are we coming out of the final lockdown? And should we be concerned about the Indian variant? I had a generic question about, is there a vaccine against the new variant? So we have this issue of the new variants and vaccination, and we have the issue of whether this will be, can this be the final lockdown? I'm as generally, I'm unconcerned who wants to pitch in, but I'll maybe, Ellie, you spoke first, so give us that. You know, is there a vaccine against the new variants, and can this be, please, the final lockdown, or is that, as James is warning us, this is maybe not the end? Ellie first.
Thank you. Never say never, never say always is a good rule in my line of work. I wouldn't want to promise you that we have seen the end of lockdowns, to be perfectly honest, but I would be hopeful that we are nearing the end. As things currently stand, James is more authoritative on vaccines than I am, but as things currently stand, the new variants we have seen are all still covered by the current vaccines. We don't know whether that will continue to be the case in the future, and it's certainly something we need to be alert to and mindful of. Lockdowns are a very drastic measure for trying to control a vaccine, and if the population are adequately trying to cover virus, we're not trying to control vaccines, sorry. If the population are adequately covered by vaccine, then the requirement for lockdown should diminish, and indeed the value of lockdown should diminish. But as things stand, the future is too uncertain for us to make any promises.
I understand that, Ellie, just briefly picking up on that, was lockdown necessary? Was it absolutely necessary? Was it the tactic that was required? Because it has been drastic for many people.
You're absolutely right, and I have to say, you're absolutely right, and I would have to say that at the beginning of all of this, there was a real division in opinion within public health. I think many of us were surprised by how well behaved the population have been and for how long. And I don't think any of us expected that this level of behaviour modification would be needed for as long as it has.
Okay.
However, as things went on, with each of the waves that we have seen, it has been very obvious that lesser interventions, asking people to simply try to meet fewer people, wash their hands more, wear face masks, those things on their own did not have the impact we needed. And if you look at what happened at Christmas, lockdown was really the only way to get out of the mess that we got into at that time. I'm
going to bring in James Chalmers, but I saw Robin Sen nodding his head at some of that as well. So I'm going to bring in Robin and then Duncan and Daniela as well. And James, on the question of, is there a vaccine against the new variants, and have we seen the end of lockdown?
Yeah, so the answer, as Ellie said, is that we don't know, but the signs are really encouraging. If we look at Israel, which is a month or two ahead of us in terms of vaccination, they've got 85% of their population vaccinated. Virtually all lockdown restrictions have been lifted in Israel, and there were less than 50 cases in the country yesterday. So they show us a glimpse of the short-term future, which is that these vaccines really work. And when the population is heavily vaccinated, we're able to lift restrictions and have really low numbers of cases. So that's fantastic. The big threat to that are variants that can evade vaccine immunity. And we don't yet know whether we're going to get a variant that can evade vaccine immunity properly. So the South African and the Brazilian variants evade some parts of the immune system, but as we've seen, the vaccines still prevent against severe disease and hospitalization with those variants. So we may need additional vaccines in future to cope with variants, but that's a question at the moment that we don't know. It may be the existing vaccines are able to get us to that herd immunity point that means that we won't then have large amounts of vaccine circulating. So I think at least in the short term, things look really, really optimistic.
Okay, I'm going to move on to Robin Sen. Robin, I'm going to bring in another question as well that really builds on this. I'll sum it down a little bit. It talks about what are the thoughts on balancing future outbreaks with the social and economic impact of lockdown. You know, it's the balance to be struck. Robin, please.
Yeah, so as I was hearing my colleagues speak there, as a social scientist, I mean, part of me feels we need to recognise the expertise in public health and listen to that, but we also need to have open conversations around those things, and perhaps more open conversations around those things with the wider public around the risks from not locking down if we go into a future lockdown, and the social and economic consequences. Yeah. And one of the things that's been really, the Marmot report in England, the Health Foundation report, and talks about building back fairer, is I think at the start, if you ask people did think that this might be a time when we would see inequalities lessen. Very quickly it became clear the opposite was the case. So I think in terms of that, if we are going to go into future lockdown, if that's necessary, we really need to have a very clear and open conversation about how we protect the most vulnerable populations within that. And I think there are some of the questions that I can see hint at this in terms of populations that weren't furloughed, or populations that, for example, have had to cope with children at home that they weren't expecting to, on very low income. So I think we need to have that wider discussion about how we protect those who have been hardest hit during the last period if we do need to go back into future lockdown.
Robert, just staying with you, a question not long ago, published a few minutes ago from Karen McCardle. I wanted to ask you specifically, what kind of issues, I mean, I'll come to this topic later, but we got this question, let's go with it right now. Asking Robin what kind of issues we're facing more marginalised people. She wants to know about that.
Yeah, I mean, if I take some illustrations rather than trying to deal with them all, I guess.
Yeah.
So one of my colleagues who co-edited the online magazine was doing research with adults with learning disabilities, and particularly around populations, adults with learning disabilities facing domestic violence. So we have the broader issue that we know there's been a rise in domestic violence from the data from referrals to police and domestic violence agencies. On top of that, we have the lack of access to refuge support that we would generally have through Women's Aid and other organisations like that. Yeah, and on top of that, we have, if you like, a population that's already marginalised in terms of public profile, but also perhaps an ability to engage with structures that allow them to access support. So I think in terms of that particular population, issues around increased marginalisation, increased exposure to domestic violence, and less access to support. And just take one other illustration was around asylum-seeking minors. So these are teenagers who have come into the country unaccompanied without parents and are in some kind of looked after status, so foster care, residential care. One of the things that happens is that there's an age assessment of a number of asylum-seeking minors if it's thought that they are older than they present. But this is a very complicated and, if you like, politicized process, because it's very hard to firmly establish what someone's age is. And a lot of the time, these young people are coming over without access to formal documents in terms of the ways that they've come over. And that process happening under COVID and under lockdown, and the possibility that somebody may be age assessed to be an adult and therefore subject to immigration controls and then subject to adult services. So yeah, yeah, those two.
Excellent. I see Daniela keen to come in. I certainly want to bring you in as well. Daniela, please.
Just to add to what Robin is also saying, head teachers also reported a new kind of vulnerability where, as we said before, people who did not expect to live together as a family with being at home together all the time experience difficulty. So families were facing breakup where they would not have had they not had this added pressure. Okay. And so head teachers were feeling the need to make themselves very available to support these families.
And what we discovered was that head teachers and teachers were changing their routine to working with families. For example, head teachers receiving phone calls at 11 o'clock at night, which usually that was not the case, but because they were aware that they needed to give more care and support to families, they were, most of them, or at least from the data that we have, were available to support families.
That's really interesting. You don't think of that, the transformational impact upon the whole of society and the economy, basically deriving from anxiety, concern. I'm going to move on to social questions in a minute, but a really good question in, it's maybe very difficult to answer. I think it's one for you, Ellie, I think, but it could be for James. Someone's who talking about running managing a charity. The majority of the clients over the age of 80. They usually run daily social activities within the centre. They want to get back to that, obviously. What they're asking is whether they need to wait until all of the staff and members have received the second vaccination. At what point, basically, I know it's impossible without knowing the details, but Ellie, at what point, for guidance, this is obviously an anxious question. And what do you guys say on that one, Ellie?
So I can duck this question quite easily because I know that this is an issue which is being given a lot of consideration at this time, and it is exactly the kind of thing that the national guidance around allowing greater social mixing in the older age group will be released. So we will get very, very clear information about this. The vast majority of over 80s in Scotland are now on their way to having their second dose if they haven't had it already. And similarly, almost all of health and social care staff have now.
So the point is, the question is basically, does this individual need to wait till all the staff and members have received 2 vaccinations? It sounds as if you're saying they should probably wait for that.
I think many people will feel that that would be appropriate, but the guidance is not yet out. So I'm afraid I would be setting up a one-person campaign if I give a clearer answer.
I said at the outset that was almost impossible. But thanks for the question. Another question, Robert, I'm going to put to you about unpaid carers, people becoming carers for the first time because of the pandemic, because of lockdown. Basically saying, don't forget these people, and you know, making a point of saying they seem to be ignored in the current election debate. But tell me about carers and unpaid carers in particular.
Yeah, I mean, I think one of the interesting things in the early submissions to the magazine was both around people with care needs and family carers and unpaid carers, and just a lack of recognition of that role in terms of the early lockdown restrictions. So the information about social distancing, the information about households not mixing, really didn't tie in very well for people who had care needs and with unpaid carers. So, I mean, I think that was the main way in which it came across in terms of the submissions to the magazines, just about the lack of recognition. I think that did get better as time went on, in terms of recognizing that there were people who were providing unpaid care. I think there's a broader issue with both unpaid care and paid care that the pandemic shone a light on, and that's the issue of a huge amount of care being given that's absolutely necessary, that's either being given for free or being given by people who are paid low wages. So I think the pandemic has shone a light on that. Whether or not there's a political will to address that, I know in terms of Scotland there's been talk about a national care service, and I don't know where that will go, but there's pledges around creating that. But I think it has really highlighted the issue, particularly with an ageing population, of both unpaid carers and low paid carers, and the amount of the size of the contribution they're giving, and the fact that we're overlooking that. Whether or not there's a political will to address that as we come out of lockdown and of COVID, I don't know.
Well, thanks for that. A really good question, and again for Duncan and Daniela, I think. Again, summing it up, doesn't appear to be a difference. The argument is between primary school, secondary school pupils and university students, aside from age. But the question is, can we therefore teach them all the same way? Get university students back on site and all in a classroom? Duncan, Daniela, is that feasible, or is it right that we have to make a discrimination between the age groups?
We always say that every category of groups of children and even university students would need their particular kind of way of teaching. I think our research focused on school age up till the age. So there it seems to have differences in terms of with younger children and older children, but I wouldn't know how to answer that in relation to university students per se, so sorry about that. But
no, that's perfectly fair. Daniela.
It seems like it's more something for public health, because it's about where the cutoff point is, isn't it? So yes, I think it is quite difficult. It has been quite difficult for people in education to manage the large groups of children in different schools. Okay, I'm gonna
unless Ellie wants to come in, I'm gonna move to another area. Okay, right. I've got an excellent question from Mandy that fits in with some questions we already have. Very generic question. I'm going to put this to all of you. What do you think post-COVID Scotland will look like in terms of health, education, and the economy in particular? It ties in with the question I had, which was, are the days of the old workplace with large open plan offices coming closer to an end? So what do we think post-COVID Scotland will look like? James, I'm going to go to you first, maybe on the health field, but generically as well.
Yeah, so I think this is the big question of the evening in many ways. What's it going to look like? And I think we all get a say in what it looks like, because I don't think it's all decided at this stage.
Good.
In my view, I think there'll be an overwhelming pressure to get society back to what it looked like before. And one of the challenges is going to be, can we can we keep some of the things that actually have been very beneficial during this pandemic and some of the developments that we've made to make post-COVID Scotland better than it was before? I give some really simple examples from a health perspective. We've seen great advances in telemedicine. I know a lot of my patients would much rather be speaking to their doctors for their regular checkups on the phone rather than face-to-face, and it's potentially safer in a whole range of different ways. A second example is a recent survey of asthma patients said that 70% of them post-COVID would like to keep wearing face masks because many of them have never had such a good year because they're not picking up viruses, they're not having flare-ups of their asthma, they're not coming into hospital because of the public health measures. So I think there are aspects of post-COVID Scotland that might look a little bit different because we've learned quite a lot of lessons from the pandemic, and there are ways we can improve public health even once COVID is gone.
Ellie, come to you. A reminder of the question: what will post-COVID Scotland look like? Health, education, and economy in particular. Ellie, please.
Thank you. So, I suppose I share James's optimism. I really do. But for me, my worry is that the inequalities that Robin has been describing will get worse, and that if strong action isn't taken, the negative impacts that we've seen on young people, on mental health, widening inequalities, marginalised groups who, when the chips are down, what we saw is that people look after themselves and push other groups away if they can find an excuse to do so. And my worry is that those gaps that we have seen will widen. And so I very much want to echo what James said, which is that we have a part to play in this, and we get to help to shape what the future looks like. We get to choose where it goes from here. And we do that with our actions, with our votes, and with what, the decisions we make, what we prioritise from here. And I think there's a potential for things to go optimistically and in the right direction, but it will take hard work and it will take a lot of effort, and we need to make it.
Ellie, just while I'm with you, Wallace literally coming in the last few seconds talking about PPE protection for frontline health care workers. Again, I'll summarise it, but basically, are the current PPE recommendations adequate when caring for symptomatic patients with COVID-19?
I think that the question is very different when you're talking about symptomatic patients and asymptomatic patients.
Okay.
And so I would say that currently the guidance for symptomatic patients is FFP3 masks. It's all of the bells.
That's what the question's about. Yeah.
And so I would say that is what we should be using, and I think that is one of the things you will see in the future. I think we will be seeing higher levels of PPE being used in healthcare settings routinely from now on, probably. I'm an asthmatic, and I'm one of those people who has been grateful to spend a winter not floored by viruses and everything else. I intend to wear my mask in more places in future, for example.
Let's go back to Duncan and Daniela. Remind you of the fundamental question here. What will post-COVID Scotland look like? Health, education, economy, but in general. Duncan, Daniela, please.
One of the things that emerge in our research is about the role of the school, the place that the school has. And what we discovered is that we very often take schools for granted. We understand that schools, are there, but this, when schools close, the whole of society, is shaken. And not only is shaken, schools are places where there is a level of protection for children and families. A lot of services come into schools, but very, very, very often we don't acknowledge that enough. So I think that's the first point. The second point is about the community.
Yes, we think post-COVID Scotland will give a greater value to the community and school links that exist and have been brought up together because of COVID. And what we would urge is that there is more listening to the local, because what communities and community groups and schools know about the local is is very, very valuable. And there will not be one solution which is a blanket for everybody. And this is how marginalized groups can be reached even more, as opposed to when we think we are going to reach everybody with the same thing. So it's important that we listen to our local communities and we listen to the groups that know, because different groups take different individuals actually take different meaning from the same phenomenon. And so the question of what's it like for you is a very, very important one, as opposed to I think I know how you are feeling about it.
See, that's good, because that fits in what James began us with here, is to saying, well, what's post-COVID Scotland looking like? It'll look like what we want it to look like, because we can shape it. I'm going to bring in Robin. Robin, the fundamental question is still, what will post-COVID Scotland look like? Bring in another question on that is this just a temporary phenomenon, you know, the impact of this pandemic, or is it a fundamental shift in how we live, what the World Economic Forum calls a great reset? So what are we looking at about post-COVID Scotland? Robin Sen, please.
Yeah, so just to pick up on a point that James and Ellie made, that in a sense this is ours to shape, and it's what we make of it. That in itself is an optimistic message. It should be ours to shape. But if we're looking at the increase in inequalities, the risk is that some of these decisions are taken out of people's hands. So if I can take a broader point, as we mentioned, about the workplace and what happens with the workplace, there's obviously an economic advantage for a company no longer running a city centre office, for example, and these things going back to people's homes. And also kind of people being on kind of contractual relationships rather than employees. So I think there may be some pushback about that, but it's about how people can organise and how that can be articulated. I think the next challenge will be an interesting one. So not everyone attending this meeting today may have been able to attend in person. So there's advantages to the move to online. But what happens when we move back to a world where some people start to attend face to face and others don't? So if this was a kind of a part live and a part online meeting, how does that work? And how does that work in the workplace? The meetings we've been having online, where we have a mixed environment, and I think that might be the next indicator of what happens in terms of, do we see a lot of things remaining online, or at least mix, or do we have this kind of move back to the more face-to-face? I do think with the move to online in terms of work things, what you miss out on is, if you like, the water cooler conversation. So a lot of the communication becomes more instrumental, and you move away from having those incidental conversations and more relational conversations. So I think that's going to be interesting to find out how that goes, particularly if we move back to a mixed environment where some people are face to face and some people are online. The other thing ties in with what was said about communities. And I think there's an interesting thing that's been happening alongside the move to the online, which in a sense gives us access to global information. We've had this hyper-localization where things have been happening in people's communities. And I think there's been some good things happening in people's communities, and a lot more, if you like, community activism and community neighborhood interaction than it has previously. And I think it would be a real shame if that got lost in the period moving ahead. And I think that's where people do have more control over that. What's happened in terms of people speaking to their communities and their neighbors and taking action, that is within their control. Perhaps the funding of it and the underpinning of services isn't so much. It depends on wider political choices, but people kind of acting together, coming together, voicing things together, that's more within their control. And I really hope that continues in the post-COVID period.
Robert, just briefly, just one that's just not long in, I'll put it to you if you don't mind. I'll summarise. Is there a linkage between the pandemic and excessive substance abuse? The pandemic a factor in excessive substance abuse? What do you make of that one?
Yeah, so the only data I have is the Marmot report, the Health Foundation one, which did suggest that there had been an increase in alcohol use during lockdown, and it also suggested a gendered effect. I think that women's alcohol use had gone up, even though it was less generically than men's. Other than that, I don't know. I mean, there's been talk of, if you like, drug cartels organising parenting, and the ways that they've responded. But I don't think we have clear data on that. But from the data on alcohol use, it does suggest that yes, people have found the lockdown stressful, that people's mental health, particularly women's, has got worse, and that would lead us to think that yes, it probably has, but I don't think we have the harder data on that yet.
Okay, thanks very much indeed for that. A question which I'm not sure who could pick up on this one. It's a question saying the pandemic has proportionately detrimentally affected women more than men. Another example, it's argued in the question of how women are disadvantaged in comparison with men. I'll put in the question, do we accept that? And secondly, does the panel have suggestions as to how to redress this future generational legacy? Ellie, come back to you. What do you make of that one?
Thank you. I think there is a lot of published research now suggesting that, for example, a lot of domestic work has fallen to women rather than men, where, for example, homeschooling has happened, that kind of thing, that has fallen more often on women than men. I know a lot of women in academia who are very much in that position of kind of taking on that additional shift. What do we do about that? I don't know. It's part of a larger societal problem. And I think that essentially what the pandemic has done in many ways is to move society back quite a long way in terms of gender parity and gender expectations. I would love to think that as things, you know, some of the improvements that we managed to bring about, some of the changes that we managed to find around distance learning and so on, that can help. And I think it is important to emphasise that, as was being said earlier, it's not all negative. Yes, taking on that additional domestic work is negative. But for example, flexibility in things like online meetings has meant that you are able to combine, not always to the best of your ability or the best of your concentration, but you can attend meetings that you might not have been able to attend in person because of childcare, for example.
Very much. Duncan, I saw your hand raised.
Yes, in fact, I agree with what Ellie is saying, because schools have reported that parents that have been usually hard to reach are attending meetings because they don't have to be concerned with childcare, and it's not such a big deal to turn up at a school, because some schools can present to some parents as perhaps forbidding, perhaps because of some of the parents' own experiences in the past. I also wanted to talk about the issue of boundaries, because parents who have been working home have had their boundaries between work and home blurred. And also teachers who are parents have had this, and we've had teachers to say, you know, I would have never answered texts from my son if I was in a classroom, but when I'm in my kitchen, then I would. And although teaching is happening in my kitchen, and obviously because boundaries have been blurred, because the pressures have increased, then that has meant that home time and resting time and family time has been encroached on.
Mm-hmm.
Okay, thanks.
And let's, for example, with teachers and the teaching staff, it's learning new technology. So it's not only trying to find the balance between family and work, which now is happening within the same, you know, hours and days and spaces, but also you have to learn new technology, which is constantly changing. So it's not learning an app and you stick with that app for 6 months. It's constantly changing and coming. And let's keep in mind that teaching online and teaching face-to-face is very different. And very often we assume that teachers were taking materials from face-to-face and putting them online, but in reality, teaching face-to-face and teaching online is very different. So we have to acknowledge that teachers in this situation were also experiencing a very big shift, very fast-paced changes, and all this obviously affects and, you know,
especially in the first lockdown, when they were not able to teach live.
Yeah. Okay, thank you for that. Robin, the question was about disproportionate gender equality, but you can maybe want to broaden that as well. But gender equality was the question, please, Robin.
Yeah, so comments really tie in with what colleagues have said. I mean, there have been some analysis of submissions to journals, for example, by academics, just as one measure, and they do show a gender effect, that men's submissions have gone up generally, and women's submissions have gone down. So I think there is that impact there. And I think when we're talking about the move to home working, particularly homeschooling, but home working more generally, it has a gendered impact. So I think we need to think about that, and it's an argument for moving out of lockdown when we can, and just being mindful that these have social impacts on particular social groups. The only other thing that slightly jars with that, I suppose, and I'd look to my health colleagues to say whether or not this is proved to be the case, but I do remember seeing things around a differential impact on COVID death rates, and I think men were more likely to have, or there was a higher mortality rate for men in most, I think, advanced countries than for women. So it hasn't all been unidirectional, but I think in terms of the social and economic impacts, they have been largely borne by women.
Thanks for that. James, please, on that, and then I've got a follow-up question for you as well. But James, on this question of gender inequality, please.
Yeah, so just continuing Robin's point, so he's correct that after age, being male is one of the strongest risk factors for dying from COVID. But again, there are gender imbalances in long COVID, in that women seem to be more affected by the long-term effect. So there are again disadvantages for women in the long term. But continuing Robin's point around journal submissions, I mean, in academia, it's clear that there's been a huge effect on women's careers in terms of publishing and submitting journal articles, and that's just one field where there's been a massive disadvantage. I think there's a lot of people have been working, and many of them are women, have been working 2 or 3 jobs over the last year and a half, thinking they're doing what they can to get through this pandemic, and how we address that and how we recognize that and undo the damage that's been done to people's lives and careers, because it hasn't been equal, is something we have to have a really serious conversation about.
James, we actually have a specific question saying, how can health and social services cope with long COVID and increased mental health problems arising due to lockdown? Maybe give us a bit more on long COVID, please.
Yeah, so this is a huge problem that I think we're just beginning to grapple with. We now have published research that shows that at 5 to 6 months after COVID, 7 out of 10 patients are not back to their previous state of health.
Wow.
It's not just things like breathlessness and those sorts of things. It's also mental health problems. It's severe fatigue. It's a wide variety of symptoms. It disproportionately affects women and women of working age. So this is going to be a really major problem. So in England, special clinics have been set up and have been commissioned, centrally funded to deal with this, to investigate it and to treat it. And it's something that NHS Scotland and the universities are going to have to look at really, really carefully, because there's a lot of these patients really suffering at the moment. And because we know very little about it, treating it is really challenging.
That's really interesting and really worrying as well. Look, the questions are still piling in, so I'm going to put a couple of them to individuals. Ellie, please, if you would take this one. Mask wearing is known to be beneficial overall. The question is, should we make all inpatients, hospital inpatients presumably, wear masks to prevent hospital-acquired pneumonia? Ellie.
Thank you, Brian. I'm not entirely confident on the pathogenesis of hospital-acquired infection, but I suspect that in the long term, the distress caused to patients wearing masks all day, every day in a hospital setting would probably counteract the benefits of the protective effect of mask wearing. James is probably better placed.
James, you're nodding.
Yeah, absolutely. So the pathogenesis of hospital-acquired pneumonia in the vast majority of cases is actually aspiration of bugs that are already in your own upper airway. Yeah. So it's not like COVID where you catch it from someone else. Usually hospital-acquired pneumonia is the immune system suppressed and bugs that are already in the person's body cause an infection. So masks are not the answer. It's been a general problem through the pandemic, I think, that people reach for masks as a solution. It's a solution to some things, but it's not a solution to everything.
I remember it was said at first, don't think of them as they don't make you immune, they don't make you invisible, canny with regard to their use. Robin, one I could put to you, if you wouldn't mind, from a good question from Mary that's not long in. Volunteer numbers. She's talking about volunteers. Volunteer numbers have increased. We talked earlier, Duncan and Daniela talking about this community engagement, have increased at a community level during COVID. How can we ensure there will be a role for volunteers in a post-COVID world? To Robin and then Duncan and Daniela on that, please.
Yeah, I saw the question come in and I thought, what a good question. I'm just trying to formulate my response. I suppose a few things. I mean, I volunteered in various roles. I've also for a short time been a volunteer coordinator, and I suppose volunteers volunteer and get things out of that, or in terms of that volunteering. And I think it's a matter of recognizing that volunteering and supporting what volunteers want out of it. I also suspect that people have volunteered to a degree because they had greater flexibility during their working lives, or they've not been working in roles. So I think one of the things moving out of the worst of the lockdown is how we can give people recognition for their volunteer work and how we can support people to continue to do that as they enter paid work and as their availability perhaps becomes more curtailed. I think more broadly in terms of society, we need to recognise, I mean, people raise the issue of unpaid carers, but I think about the importance of volunteer work. And as I say, volunteers get things out of that, but I think there needs to be a broader recognition of the contribution that's giving economically, but most of all socially.
Robin, I'm not sure if this is for you or someone else. I'm going to bring in Danielle and Duncan in a minute, but one from Thelma Ingram about the care workers caring for the disabled, especially those with multiple conditions. Thelma saying that care was withdrawn and said it was hugely unfortunate. Will these people, she asks, be identified better and supported in any further need to shield or lockdown? Robin?
Yeah, I mean, whether they will be, I think it's one of those big questions that we don't know. What I would say, I think, as I said at the beginning, the discourses at the beginning, these general discourses about social distancing. For example, we had an article by someone working with deafblind people saying that the messages about physical distancing were really unhelpful for that community. So talking about social distancing rather than physical distancing, because their communication is dependent on some kind of physical contact. So I think as time went on, and you could see kind of little emblems of initially the government's broadcast on COVID didn't have a sign interpreter. Later on they did. So I think there was some movement around the recognition of particular groups as time went on. And I think if we were to go into a further lockdown, we'll be starting from a better base in terms of recognizing groups that went under the radar at the start. But as we've said, inequalities have increased, and the big problem is, do we as a society remember these groups, or do we remember one and not other as time goes on?
Does it slip into the memory? Duncan and Daniela, would you tackle one? It's a pre-submitted question. We've got loads on education, but this one maybe sums up the others. How are we going to help children have fairer outcomes in their education? Because clearly some will be significantly more disadvantaged than others. Duncan and Daniela, please.
I think this question needs a little bit of unpacking, because we need to acknowledge that all children went through this situation. So that's one of the things that we need to keep in mind. What certainly emerged from the data is, I think we already mentioned this point, but I think it's worth emphasizing, because very often schools know of groups of vulnerable children, and very often they try to cater and support those children. I mean, with all the difficulties and limitations, but very often they were already, they're trying to cater for. What this research has shown is that there were groups of children who usually would not fall within the group of vulnerable children, but are now part of the vulnerable group. And those are the children that usually are not caught or were not caught within the system as yet. And in fact, the head teachers talked to us about children who are at the edge of care, and they called them, for example, they were not looked after children in the legal sense, but they were
should be looked after or not yet looked after. And there were great concerns about those children who did not have the kind of support system that other children who were looked after had. But teachers and head teachers talked about how the funding that schools were able to use to their own discretion was used in order to be able to reach these children and families. And so this is why we also want to reiterate that we need to be listening to the schools about what it is that they find useful, because solutions which are blanket are not always helpful.
And just the last point, we are seeing a difference between the first lockdown and the second lockdown in terms of how schools reacted to this. And I think this adds to Robin's point that they were learning from the first lockdown and trying to adapt to changes for the second lockdown.
Okay, I'm going to move to what I suspect may have to be the final question. So maybe put some closing thoughts in your answer here as well. Very good question, just come in. Says there is a lot of reluctance within communities and young people to have the vaccination due to what is described here, not my view, but not my verdict, but due to what is described here as the experimental nature of it. What advice would you give when speaking to people to reassure them about vaccination safety? I'm going to go to James Chalmers there first of all, please, on that, with perhaps some closing thoughts on where we're heading.
Yeah, so just to say on the vaccines, I mean, the vaccines are one of the safest interventions I've ever seen in healthcare. I mean, these are incredibly safe, highly tested vaccines. They're not experimental in any sense. They've been through major phase 3 trials. The way I've explained this to people who are really worried about the blood clots is to imagine the day you're going for the vaccine. You jump in your car, you drive to the vaccine centre, you walk down the street. Your chance of being in a road traffic accident in a car is 1 in 20,000. Your chance of being struck by lightning, funnily enough, is about 1 in a million or 2 in a million. Your chance of getting a major side effect from the vaccine is about 4 in a million. So your vaccine is safer than many of these things, like walking down the street, crossing the road, driving in a car. So this is one of the safest things that you will do in your week, in your life, and it protects you from COVID, which if you're a young person, you may not be worried about the risks of dying from COVID. But as I've mentioned already tonight, my clinics are full of young people who are suffering from long-term effects of COVID. Even if you're a young, healthy person, you do not want to get COVID. So get the vaccine. As I say, it's one of the safest things you'll ever do in your life.
Thank you very much. Robin, on the vaccine reluctance, but also on a general thought, are we heading to sunnier uplands? Are we heading to better times?
Yeah, so I mean, I can't add to what James said in terms of advice. I mean, brilliant kind of way of explaining it. I think the data I saw did show, after some concern about particular communities, Asian communities, for example, or parts of the Asian community not taking up the vaccine, the uptake had been pretty good. So I think it does seem that the message is getting across. What to say in terms of a broader sociological point, in terms of the, if you like, the conspiracy theories and the online spreading of those, it did seem to be, if you like, take less hold than some of the other conspiracy theories that we've seen gather momentum in the political sphere and so on. So it's interesting to see that the public health message seemed to have got through. Now, whether that's because people accept that it's a very low risk or it's something else about the messaging, I couldn't really say. In terms of sunnier uplands, I think we've got a lot of work to do. I think I would like it to be the case, as James and Ellie said, that this is in our hands of what the future is. I'm not sure it is totally, but I think we can have a role in saying what we want moving out, and come back to Marmot's idea of building back fairer. I think we all who think this is necessary need to articulate that it is necessary, that there has been a rise in inequalities, that there has been problems that have affected particularly vulnerable communities, and we need, as we move out, to be keeping the focus on that and keeping the focus on the need to address that as we come out of it.
Thanks. Daniela, are we moving to happier times? Or Duncan? I'm not either. Yeah.
One of the things that we came up from the research is the idea of kindness and care, and if we can take those kindness and care that emerge from this lockdown and continue acknowledging these two very important values within our Scottish community, I think, you know, we would have moved forward in a very good way out of something which was.
And teachers did a great job at engaging young children online with laughter and silliness, because they realized that this is the way how to be able to reach those young people that they could not have in front of them.
How absolutely wonderful. That's terrific. Ellie, they've got a vaccine question. Perhaps you want to amplify the points made by James, or perhaps you want to give us a generic thought on where we're heading.
James put it so well. I really couldn't hope to capitalise any further on that. But please have your vaccine. The kindness is such a great thing to finish on. I think it's worth just remembering that so many people have worked so hard through this last year and a bit within health, within public health, within education. My goodness me, I've met a lot more teachers in the last year than I was expecting to, and I would absolutely echo they have worked so hard. Families have worked hard, the people who bring our food, the people who have emptied our bins, the community has in many ways pulled together in so many places. We have looked after each other so much of the time. It can be easy to forget that. And if we can build on that, if we can bring our community closer together, be kind to each other, and continue looking after each other in the future, that will take us in the direction we want to go.
What a superb message with which to end. Many thanks to all our panelists tonight. Absolutely superb contributions. Thanks to those who submitted questions. I couldn't take them all. There were dozens and dozens of them, but they were terrific questions. And just a final thing to say is that a recording of this event will be available on the University of Dundee Saturday Series webpage in due course. From me, Brian Taylor, thanks again to all of you, and toodaloo.